Welcome to The Secret Life of Parkinson's, a podcast created by people living with Parkinson's to help break the stigma of a disease no one likes to talk about. Now, here are your hosts, Jessica Krauser and Brian Baker. On our podcast today, we're extending what we had with Dr. Rammo already, so now it's our second segment. And we brought in Dr. Ben Walters again, and this is your second time.
It is.
Yay!
I came back.
I know, that's a good thing. And thank you guys so much for coming down again. We really, really appreciate it.
It's our pleasure.
But we've gotten so many amazing questions, and there's so many people interested in DBS, and I think because he and I are the age that we are, and we're in this for the long haul, that we want other people to know of all the different therapies that are available to them if they so choose. So we just have some questions to kind of hit you guys up with. Mm-hmm. So does DBS do anything for RBD, the REM sleep behavior disorder, whatever that's called?
I think we're still learning a lot about DBS and sleep. I think that's a good question. I think there's studies that show some data about RBD and DBS, but I don't think we really know. Okay. We have a lot of people that are looking at all the different aspects of how DBS may benefit or help or affect sleep, but also how to optimize it for sleep. Is there something that we could do different with DBS, particularly now that we have adaptive capabilities that would further enhance sleep or customize how we're stimulating to sleep? The rhythms that we see in the brain when we're sensing when you're asleep are very different from when you're awake.
Yeah, I saw
and
mine.
So it does adapt with adaptive, but it's a further question. Do we need a different thought process that's doing something different with sleep?
Do you
it may
sleep better?
be.
I sleep better, but that's because I'm not so tense. Like I was before, like I would wake up either halfway through the night, and I always question, I'm like, did the tremor wake me up, or did I wake up and have a tremor? And it just started because I am awake now, and I never could figure it out. But now I still sometimes will wake up at 3 or 4, but I fall right back asleep. But I sleep pretty soundly now, which is awesome.
Fantastic.
And I'm like, please stay, because I know you still have trouble with sleep, don't you?
Not nearly like I used to.
Yeah.
Sometimes I do take some
Supplements.
medication, supplements, gummies.
It's okay. It's a safe space.
Ironically, the better you sleep, the better your symptoms are the next day.
Yeah.
So it all kind of syncs together.
Yeah, because when I was miserable, when I wasn't sleeping hardly at all.
It's like maybe the DBS manufacturers need to get together with the Inspire company. Don't they have the Inspire for sleep?
Yeah.
Because I know
Sleep
people
apnea.
have had that. Yeah, sleep apnea. It's like another thing that goes in your chest. You were saying something though about an unhealthy brain and different things. Is memory or like the cognitive play a part in that? Like, can that be considered unhealthy? And like you wouldn't. So if I had cognitive decline or executive function.
Yeah, so I think you asked before earlier with Dr. Rammo about putting more than one lead in at a time and the effects of that. For somebody who's young and healthy, the brain is fairly resilient. But if there's more vascular disease and there's more atrophy, there's more changes within the brain that occur with aging or other medical issues taking a toll on the brain, then you're not going to tolerate what other people tolerate very well without a problem. It's just passing the lead in without confusion or changes. And so one way we look at it is with imaging and to see how healthy the brain looks. The neuropsychological testing tells us how healthy the brain functions, particularly for higher level thinking, which is important. And people that have either of those or both, we know have more difficulty going through surgical procedures like this, even though they are more minor compared to some neurosurgical procedures. And so taking a more cautious approach for those folks may be important.
So you were talking about you guys all get together and you assess and see how all the different testing went. Do you ever encounter people who went to, one hospital system, got testing done, and they said no, and so now they're almost like shopping around for somebody to say yes? You guys get that with DBS?
I don't know if I'd say shopping around, just because maybe they just truly feel like they are a candidate, and maybe they didn't feel like they were taken seriously.
Okay.
But just, we definitely get that, and we see that a lot. And it's case by case type of thing where we have to kind of determine why they said no before, and whether it's just like a comfort level at the other center, or whether there's a really concerning thing like they have a bleeding disorder and huge risk of like a bad thing.
Do you let people retest? So like if you said no today to somebody, is there a certain timeline that they can come back and?
Yeah, I think there are situations where, we're taking a look at how somebody's doing at one particular time. So sometimes patients don't do very well on the memory testing, and they're on a lot of medications that might be interfering with that. So in those cases, we'll usually try to work on optimizing their medications better, getting them off of medications that impair memory, and seeing if they're functioning better. It's not going to usually be, night and day, but they could be a whole lot better, still enough where it would make a difference. They still might be at somewhat higher risk. Same thing with like the levodopa response testing tells us a lot about at least the symptoms that we expect that respond to medications that should respond to DBS. And if somebody doesn't improve much on that testing or enough, it suggests that those symptoms wouldn't respond. Sometimes those patients come in and for whatever reason, they're just not off. Their meds aren't really off when we start to take, and then we give them the medication and they're not really better because they weren't off to begin with. We'll take that into account. In some cases, it may be better to retest and bring them back and see that they can respond and help educate them. A lot of that's giving people realistic expectations about what they should expect with a DBS if we do it. And if we don't understand that and they have a false idea that it's going to have a huge difference where everybody's different. Some people, it's really big. Some people, it's smaller. It's hard for us to say where you draw the line because that's a very personal, individual decision for a patient. But we can understand at least whether people understand what we're telling them about that.
So I remember for mine, I don't know if you know your percentage or not, but you guys said that I had an 80%, what's that called? 80% improvement.
That's huge.
That's great.
Amazing.
85.
Oh, shut up. No,
I swear to God. I swear to God. He was shooting for
you were just saying that.
Competition.
He's right here. He was shooting for, he goes, I think we
Maybe
can
mine was 81%. I don't know.
He said, I think we
Those
can
are
get you
all
about-
great numbers,
He
by
goes,
the
I think
way.
we
Do
get
I
you-
hear 86?
But honestly, I say that because I was almost afraid when I was in there because is that what you guys do with the PT test? Like when you're off versus on? Like not PT, sorry, but like the
levodopa response testing,
Yes.
the on-off testing.
that's when you're
What about, so I know Dr. Patel, he does the scale, the Parkinson scale.
The UPRS.
Yeah. And I think he said I was like a 23 when he first saw me. And after DBS, he's like, I think I was like a 2 or 3 or something like that.
Oh, I don't know my numbers.
Come on, man.
Well, no, because Dr. Malone said honestly, don't worry about the numbers. She's
Nobody
like, just worry
cares.
about where. No, but it's like because it's different. It's done for different reasons.
Right. No, but for me, it just showed that we did get the improvement that I was targeting.
Yeah, which is great. But I was kind of shocked when I heard of the number because most people don't see my Parkinson's. Like you can see like the dyskinesia that I was having, but like that stiffness. So while I can't explain it really well, it's like so the fact that you guys can see it. I know that's what you're trained for, but the fact that it was able to come through, and I know it's come through even now on the DBS, like on the screen when Ellen looks at the Medtronic thing, she's like, oh wow, like you're really responding. I was just afraid that I was going to come back and they're like, you don't really have anything wrong with you. So when you guys said it was an 80% improvement, I'm like, okay, good. So that's what I feel is accurate, and the medication's working, and that's why everyone's like, you don't look like you have Parkinson's. So I was like, well, because it's doing its job.
What about
What it's supposed to do right now?
What about some common misconceptions about Parkinson or about DBS?
It's not experimental. I think that's a huge thing. Yeah. It's something that's a tried, true, proven, with a lot of data backing it up. We really try for the best. It's minimally invasive. We try the best for our patients. And you guys can tell me, but the next day, how did you feel? Like, I mean, people think I think they're going to be comatose for like 24 hours, but
Oh yeah, I'll have Steve show pictures of me from like right after, even like the next day, and I'm like, I'm ready to go home. And I went and I had Panera like 2 hours later.
Yeah.
I walked down there with my husband. They're like, "Do you need a walker?" And I'm like, "No." I'm like, "He'll just walk with me," and it was fine.
You're pretty much normal, maybe just a little tired.
All I could think about after that first surgery is like, God, when is the next one? Like, why isn't it here yet?
Yeah.
You just want it done, but it's like I just couldn't think of anything else. But I was still fine, like, you know, taking care of the kids. I didn't cook because I didn't want anything. I was like very conscious of not tearing anything and like not, because I'm like, I'm not going back to get anything done or repaired. I stayed out of the sun. I wore a hat.
You're like the perfect patient.
All the things. Because like I was like freaking, like I was
How
freaking
did you
out.
feel by, and I know you guys are usually asking the question, but maybe it's good
fine.
for me to know, like, how do you feel like your anxiety for the first surgery versus second? And how can we make people feel better for the first surgery? Because most people are more relaxed.
I know. Like, it's weird. And again, I have like video of it. I'm like, I remember like that first surgery. I was so excited at that point. Okay, it's the day before. I'm currently at the Cleveland Clinic. I'm waiting for my room, and I'm actually super excited.
That's wonderful.
And I don't know why. Like I was so at ease. I thought for sure, I'm like, I'm gonna get down there. They're gonna wheel me down, and I'm gonna be sitting either in the OR before I get in there, and probably start like getting emotional because I had my appendix removed like 10, 15 years ago or something. And I was crying, like the anesthesiologist was with me, and I'm like, I don't know why I'm so emotional, but I have 2 little kids at home, so please make sure everything goes okay. He's like, it's an appendectomy, and then for this one, I'm like, yeah, let's go. So I honestly don't know why I felt that way, but talking to you guys, you know, put me at ease. You know, I wasn't in the hallway that long, and you know, just everybody was very welcoming and just comforting, and
it ran the Cleveland Clinic, and I can't compare it to any place else, but it just ran so smooth.
yeah, it really did.
Boom, boom, boom. There was no questions. You go here, you go here, you go here, you do this, and I was like, wow, this is like a fine old machine here.
And all the nurses know so well too about DBS. And like the second time I came in, they're like, "Hey, I recognize you." I'm like, "Yeah, I'm the young bald one that's walking around on the neurology unit." But yeah, that actually was also very helpful. But I don't know what to ease. I don't know. You guys did a really nice job.
Some patients feel like the pain's going to be so bad after, but a lot I tell me that they just have some pin site pain.
That's the
Incision
only
might not
pain.
even
That's
hurt
the
at
only
all.
pain I had, and I actually don't think. I don't think I took the full pain medication. I took extra strength Tylenol.
Oh, that's amazing.
Just because one, I don't like the idea of that, but I did take it after this third one. The third one was the hardest, and I think, and I'm wondering too, because you said as you get older, your brain shrinks, right?
A little bit.
Is it because I'm just
Everyone's a little different.
Well, however you said it, you said it much better than I just did. But
yours
like,
is so beautiful.
It'll be perfect forever.
but no, but like, so with where the leads are sitting and like how they go down your neck and everything, I was saying like how mine was sore, like my head over here was sore for a while. And I thought, I'm like, is it because this is like the skin is stretching and it's not supposed to stretch, you know? Like
Probably some nerves are just irritated, and after a couple of weeks, the nerves kind of grow back and it hurts less.
I think it took 6 months to a year before I even forgot that I kind of had that wire.
Yeah, so I brought this up, and it's a good thing to
cord.
touch on. I thought I was just being crazy because I would ask everybody else at the gym. I'm like, did you feel like your thing and it's like getting stiff? And they're like, no. So I asked the question earlier of like the wire. I feel like in the morning I'm like stiff, and I was like, is that normal? Like, is it shrinking? Is it pulling? And you said it was just a scar tissue, so make sure to do exercises.
Yeah,
right?
just once after it's been a few weeks and everything's healing well, just kind of do some stretching, gentle stretching, like motion along the extent of your, kind of neck range of motion.
Yeah. All right. Well, thank you guys so much for coming down. We so appreciate it. And yeah, so we have more to come on DBS. So stay tuned. We'll see you next time.